Welcome to the HealthLinks podcast, presented by the HealthLinks family of services. I'm your host, DJ Thatcher. Our mission here is to engage in conversations related to the health and medical landscape of South Carolina so that we're all better informed. Remember, our podcasts are also video-based, so check out the video cast. You can see our guests and also any pictures or videos that they might have as well. Our focus today is being the best that you can be from a physical standpoint. We're joined today by the principals of the Joint Effort Movement Center. That is Courtney Stearn and Gina Aicardi. And welcome to the HealthLinks podcast.
Awesome. Thank you so much, DJ. Thanks for having us today. Thank you.
Now, your practice name is pretty cool. So the Joint Effort Movement Center, tell us just a little bit about that and what it means.
Yeah, so my vision was to have a practice that had multiple disciplines, that was very interdisciplinary, where we can communicate with other providers. Sometimes when people have some chronic things going on, maybe they didn't do well with just one type of discipline. Sometimes they need a little assistance from other things. So we have physical therapy, we have a massage therapist, we have a reflexologist, we have an acupuncturist, and we have a Pilates instructor, all under one roof.
You know, so you mentioned physical therapy, and maybe for the average person out there who never sees a medical practitioner or anything, they think of physical therapists as the people you go to when you break a leg and you need some rehab, or the person who takes care of my elderly relative learning to walk. And yet, when you check out your website here at jointeffortcharleston.com, it is a whole lot more than that, isn't it?
Definitely. Yeah. I mean, I think what we definitely try to advocate for is not just waiting until you are at the point where you can't do any of the activities you want to do, or your quality of life is so negatively affected by your physical limitations, to seek physical therapy. So yeah, we end up seeing clients that maybe can't run as hard, or they're still able to do a lot of their activities, but they're noticing that their bodies aren't managing those activities as well. So they start to come in, and that's when they're really going to be successful with the physical therapy. So it's good to know that, you know, we're not just there for when you have those like traumatic or major injuries or surgeries. Like, we can really do a lot to improve your quality of life and make it so you're at a much decreased risk of developing those injuries down the road.
Let's take a look at both of you. Now, we have a lot of people who listen to the podcast who are maybe in the medical field, or they're considering it. And so it's always interesting to hear how people got involved in what they're doing. You know, Courtney, you're the founder, and as the website says, you're the fearless-ish leader of the Joint Effort Movement Center. How did you come about just getting into this line of work and founding the center to begin with?
I was managing a clinic out of town, and at the time I had an infant son, and I just literally woke up one day and was like, I'm really tired of driving a long distance. So I decided to go off on my own, because I really wanted to be able to treat patients the way that I wanted to do it. I didn't want somebody limiting the time that I could spend with them, or making me see a certain number of people in a day. I wanted to have the flexibility, and that's something that I bring to all of my staff. I give them their number of hours that they need to work, can treat however they want to. So they have a lot of flexibility within their career. And then we can spend as much time as we want with our clients. We have some clients that drive from out of town. Sometimes we'll see them for an hour and a half or 2 hours for that session, because we know they're only going to be coming once every 3 to 4 weeks. And it's not something we're going to see them 2 and 3 times a week. So developing this was just an idea that I had. It's really amazing to see it come to fruition. I have an amazing staff of women. We call ourselves the Gal Squad. We get along really well. We do fun stuff. We just went to a River Dogs game for our second anniversary for the company. And, it's just so awesome to see my vision coming to life.
Congratulations on that. Yeah, I love the Gal Squad concept, and great pictures there on your website. Now, obviously, you're both well educated. You both have doctorates, as today physical therapists do have that doctorate. Interesting, though, I know, Courtney, in your case, you received some scholarships as being a competitive baton twirler, and also a champion in that. I don't know if I've ever met a champion baton twirler. How did you get into that, or what's that like from a competitive standpoint?
Yeah, definitely. I started when I was around 5 years old. My mom was a majorette, but she got me into twirling, and I started competing. I was going to nationals by 7 years old. I was advanced by 8, and I think the top place I've won 3 batons. So if this doesn't work out, I can go join the circus because I can juggle really well. But yeah, and I received a scholarship at East Carolina University for twirling, and I twirled all through undergrad and through my doctorate degree for physical therapy. So it was a lot, but it was really fun and rewarding.
Well, and you've got a lot of credentials here. You've got the postural restorative certificate, the first one in South Carolina. We can talk more about that in just a moment. Also, a 40 under 40 award recipient as well. So, congratulations on the success you've had so far.
Thank you so much. It's going well.
Absolutely. And Gina, from your standpoint, I know you're the lead physical therapist there, and you also have this certificate in the Performing Arts Medicine Masters. And what's that all about? The Performing Arts and Medicine and so forth. Yeah. Sometimes those terms don't go together, but obviously they do.
Right. Yeah. So my background is in dance. So I grew up dancing. I taught dance for a while through college. And I've always had a passion for eventually treating dancers as a physical therapist. And at Shenandoah University in Virginia, which is where I received my doctorate, they offer through their athletic training program the Performing Arts Medicine Master's Certificate. So I completed that program, and it pretty much just emphasizes like treating, and it's for any healthcare professional. You don't have to be a physical therapy student or physical therapist to do that. It's a combination of athletic trainers, occupational therapists, physical therapists, but you focus on treating the population of dancers, musicians, even vocalists. So this is a group, it's common to say, okay, athletes, sports athletes need physical therapy, but dancers, musicians just as much need access to physical therapy, and to have someone that has that background can be really beneficial for them. So that's kind of, I started the dance rehab program here at Joint Effort, and working on growing that as well.
That is very interesting. And again, something that most people probably don't consider when it comes to a physical therapy type of practice. And hey, going back to the postural restoration, I know you're, I believe, the only practice in South Carolina who offers that. What is that all about?
It's especially geared towards looking at the body as a whole unit. So in physical therapy school, when it comes to treating orthopedic problems, knee pain, shoulder pain, we learn all about the insides and outs of every joint, how it moves, how the muscles that are attached to it. Sometimes, though, we don't get that deep into the connections of to how everything actually works together as a whole. Your jaw is connected to your hip, and your tongue actually has a fascial connection that goes all the way down to your feet. So there's lots of other influences that can affect some of your function. So for people that traditional orthopedic methods may not have helped, sometimes it's because there's something else that may be driving the train, as I call it, or driving the ship. We try and figure out what's driving the ship. If it's not a musculoskeletal issue, it could be a diaphragm problem, it could be a neurological issue going on. Our respiratory system is a very powerful system, and it is involved in our digestive system, it's involved in our posture, it's involved in our musculoskeletal system, our airway, sleep apnea. That's a huge issue right now. Mm-hmm. A lot of times people coming in that are having knee pain or back pain or hip pain, they also have some of these other things going on. When you address those, what we call the deeper problem, a lot of times not only is their knee pain better, but they're also breathing better and sleeping better. And so we're able to influence the system as a whole versus just looking at the small part that they're coming in for.
Okay. Well, so that whole postural restoration certificate is a postgraduate certificate, right? And that might be something that people who throughout the state, as we have listeners in every corner of the state, they might be interested in coming to the Charleston area to follow up with that, it sounds like.
Yep, definitely. So Gina and I both do postural restoration. I just got my certification in December. Gina has all the coursework to get hers as well. It's just a matter of time and when she wants to fill out the application. So, but as far as we know from the Institute, we have taken the most coursework between the two of us through the Postural Restoration Institute. It's based out of Lincoln, Nebraska.
Okay. Well, that's very interesting. And something else, again, as we look at your website, you also offer a service called dry needling. And what is that all about?
Yeah, so I'm certified in it's functional trigger point dry needling. So what I do is it uses the same tool as acupuncturists. They use, these like small monofilament needles, but it's a completely different practice. So we look at trigger points, in other words, knots in the muscle that maybe are inhibiting your ability to strengthen other muscles or just won't let go. A common area is tension in the upper traps. So a lot of us experience that. So what I do is I take the needle and I penetrate the trigger point and move it around a little bit, and it helps release and create a twitch response, and it actually helps release the muscle. So not only to give the patient relief of their pain, but also to allow them to be more successful with their exercises, because a lot of times when you have those chronic trigger points, it can really affect your ability to properly strengthen your core or strengthen the things we're trying to strengthen, because those muscles are just so dominant and they just won't let go.
I see you have a full range of acupuncture services as well. You have an acupuncturist as part of your staff. Is that one of you, or is that someone else?
No, that's Brittany. She actually sublets one of our rooms, but we do a lot of cross promotion. She has a doctorate in Oriental medicine, and she has a full range of services. She has some unique massage techniques that our massage therapist doesn't do. She does fire cupping. She has a lot of fun little tools that she has in her practice. So we are just thrilled to have her.
Yeah,
a doctorate in Oriental medicine. That sounds like another podcast just in itself. That's very interesting. Wow. And then you also offer reflexology too. And what is that all about?
The reflexology follows the same line as acupuncture with the meridians. So reflexologists, they believe that the areas on the foot, the foot is a representative of your whole body. So different parts of your foot correlate to different parts of your body, whether it be your digestive system or your brain or your spine, sometimes hormones like your thyroid. And so what she does is she goes through and she pushes on those like points, like acupressure, and she can find what areas are, I guess, you're having issues with, whether it be just internally and you don't know about, or whether it be from more of an energy standpoint. I can tell you personally, it's one of the best naps that I've ever had. It is extremely relaxing, and I personally will go when I'm feeling very overwhelmed or very stressed or anxious. It is a way that has just really quickly relieved stress. But we have people that go to her for a wide variety of different reasons, to balance hormones, to balance, to help with sleep, to help with anxiety, foot pain, chronic foot pain, or just neural tension. So a lot of people see her for multiple things.
Obviously you offer a full range of rehab services, as we would expect from physical therapists. But a lot of what you're doing, it sounds like, is also for preventative or just ongoing health issues like Pilates as well, so you're a one-stop shop. Can you tell us more about the Pilates also? I've done a little bit of that, but how does that help in the whole body wellness?
Emily is our Pilates instructor. So she, especially as like the dance physical therapist, that's been a huge adjunct to what I'm doing, because a lot of, and not just with the dancers, but a lot of our clients, who are really enjoying the work we're doing, and they maybe don't require the physical therapy side of things anymore because their pain's gone. That's a really good transitional program they can go into, is the Pilates work, because the way she practices is very similar to the concepts of how we practice with the postural restoration work. So that's honestly been a pretty awesome service that we've had, to offer to our clients. So it's growing. It's pretty new, but I think it's going to be pretty successful.
Well, it's good. I mean, you're in a dynamic growth period right now, so that's a terrific place to be. So people who are listening who might be thinking, I just need to be taking better care of myself. Walk us through what that's like if they contact you and say, hey, I'm not really sure where to begin, but I'm just not in the physical condition I want to be in. What does that look like as they...
Yeah, definitely. So, we're pretty open as far as if somebody calls and they want to speak to one of us, we don't make you sign up for calls and, special discovery things or anything. You can chat with us. You can email us. Our emails are on our website. It's very easy to reach out with us. We provide physical therapy services under insurance. We are networked with some of our insurance companies. We're working on getting in with a few others. We are networked with Medicare, Blue Cross Blue Shield, Aetna. We're working on Humana and TRICARE to add on. But if you don't really necessarily have any impairments, you're not having pain or loss of function, you can also see us from a wellness side where you're just, hey, I want an assessment. I just feel like my posture's a little off, or, I want to be able to, I'm working on doing a marathon coming up and I just really want to be in peak shape, or, I'm new to exercise. I just don't really know what to do. And we can kind of help point you in the right direction depending on what it is that you're looking for.
I think that's on the minds of a lot of people. It's like, hey, I know I need to be in better shape. I want to be in better shape. I just don't know where to begin. I'm inundated with so many different options. So it sounds like you can help to create that plan for people. Is that correct?
Definitely. Like I've told people, if you don't know how to fix a toilet, you're going to call a plumber. If you don't know how to fix a faulty wire, you're going to call an electrician. If you don't know how to exercise, then there's nothing wrong with going to somebody to teach you how to exercise. I mean, even us as professionals, we take Pilates classes with Emily, and we, go and work with personal trainers and different things because we want to, learn different techniques or learn new exercises or ways of doing things. So there's no taboo. And if you don't know how to exercise, it's totally, that's actually the safest way, is to find you a good trainer to work with for a short period of time.
You have the gal squad there, as you said, of the staff, but your practice treats, I assume, everyone, right? All ages and male and female. Is that correct?
Yeah. We treat anyone and everyone. So male, female, we treat from, I think a 6-year-old and all the way up to however any geriatric patients. So we treat the whole range. I
think we've had a 93-year-old in, very, very active 93-year-old. Yeah. So yeah.
Yeah. And again, that's probably what a lot of people think about is, hey, a physical therapist helps us as we get older. But yeah, so you say you have a 6-year-old and other children. What types of things are they coming to a physical therapy practice for?
Mainly the dancers. So I've had some very young dancers, that have suffered from ankle sprains and things like that. So those are always really fun to treat, and they heal very well. And
that's really good to hear, and that obviously opens up your services to a whole lot more people as well. So, well, as we finish up here, hey, what are some ways that people can get a hold of you at the Joint Effort Movement Center? Our
website is jointeffortcharleston.com. That's probably the best way to reach us. We're on Instagram. We're on Facebook. We have our emails are on there if you want to reach out to us, but our website's probably the fastest. We're located in West Ashley over near Costco. So our location is pretty convenient. We're off of Henry Tecklenburg. So, we're pretty convenient for the area and pretty easy to get a hold of.
Well, Dr. Courtney, Dr. Gina, thank you so much for joining us here on the HealthLinks podcast.
Thank you so much.
Absolutely. It's been our pleasure. And folks, you can reach out to us here at HealthLinks Podcast for any questions you might have about our guests or maybe suggestions for future podcasts. And you can reach us directly at listen@healthlinkspodcast.com. I'm your host, DJ Thatcher. Thank you for joining us.